So, hey guys, today we will be learning a few questions. First of all, most common used Mapleson circuit. So, that is type D, Bain circuit. ET cuff pressure. So, 25 centimeter of water, that is the cuff pressure for endotracheal tube. Then capnography, and you can see the capnography after intubation, and also you can detect end-tidal CO2. Means intubation is there. It can be endotracheal or endobronchial. We can't differentiate by looking at this capnography. We have to auscultate and look for the breath sounds. It will be absent if it is an endobronchial intubation. One side it will be absent. Tracheostomy will decrease ventilation perfusion ratio. Efficiency of Mapleson circuit in spontaneous ventilation. You can remember the mnemonic a dog can bite. So mainly it is type A. More than dog, that is D, F, E. That comes in that order. Can bite, C and B. Controlled ventilation, dead babies can't assist. So starts from D. Vein circuit is for controlled ventilation. So D, along with that you remember DFE. Babies, B, can't, C, assist, A. Propofol infusion syndrome, when you are using more than 4 mg per kg for more than 48 hours. Propofol, if infusion, then it will cause what syndrome? Cause a lot of symptoms like related to heart muscle, like rhabdomyolysis, cardiomyopathy. But remember, there will not be nephropathy, that will not be there. Most common complication of interscalene and supraclavicular in both. Commonly it is phrenic nerve injury, but severe thing for supraclavicular it is pneumothorax. Pre-oxygenation you have to do for 3 minutes. Transient neurological symptoms seen in spinal anesthesia when given with lidocaine. Most common size for gastrinoma is duodenum. It is not a pancreas, it is a duodenum. Ca and amylase both are elevated in IPMN, whereas only Ca, mucinous cystadenoma of pancreas. So mucinous cystis, C for CCA elevated in IPMN both. Remember, hepatitis E, there is no carrier stage. It is also fecal-oral. Adrenolytic drug mitotane, that is given for Cushing syndrome. Sarcoidosis, liver test abnormalities, elevated alkaline phosphatase. Breast milk component for intestinal cell maturation, epidermal growth factor. Then lactoferrin is having antimicrobial action. Most common psoriatic arthritis, asymmetric oligoarthritis. Nocardia resistant to penicillin, cotrimoxazole. Corneal ulcer with autoimmune etiology. Moran's ulcer, remember it is from periphery to centripetal, and there will be in periphery overhanging edge involving the limbus. PaO2 to PaO2, there is a huge difference, that the gradient will be increased if there is interstitial lung disease. Though you are supplying oxygen, arterial oxygen is not improving because of that diffusion barrier. EF2 is for elongation factor. EIF is initiation factor. Then next FAD requiring enzyme is gas. Glycerol, phosphate dehydrogenase, acyl-CoA dehydrogenase, succinate dehydrogenase. Tissue that can metabolize everything, glucose, ketone body for ATP production is skeletal muscle. LCAT is converting cholesterol to cholesterol ester. Mn2 plus is a cofactor for isocitrate dehydrogenase. Another important point you have to remember is thiamine is not involved, though it is a case of oxidative decarboxylation. Enterotoxin F is, you can remember fat. It is toxic FA, it is T, toxic shock syndrome toxin, TSST. Bacillus cereus, remember bed. That is incubation period first occurring emetogenic, then diarrhea. N cycle of beta oxidation, you know that N number, NADH, FADH2, everything will be there generated. How many acyl-CoA is N by 2, it's half. Enzyme required for purine synthesis is big one because purine has two rings. PRPP, glutamate amidinotransferase. Glutamine amidinotransferase. Pyrimidine, it is PRPP synthetase. Minimum score for induction of labor is 6. Uterus 2 plus 6, 8. 2 is pelvic organ, 6. 8. 6 it becomes involuted and it becomes in the, it will be in the pre-pregnant state, but radiologically at 8 weeks. Alpha fetoprotein, molar pregnancy, it will be low. HCG, you know it's high. AFP will be low. AFP low in syndrome like Down syndrome also. Protein that stabilize actin filament is actinin. Figlo is related with histidine. Sinus infection in skin, and they are saying you can have DDs like actinomycosis and botryomicosis. Therefore, yes, sometime question there will be GMST negative, then it will be staph. Hemolytic anemia. Hemolytic anemia plus, so plus Coombs test, then you have to remember it's autoimmune hemolytic anemia. Causing leukemia, it is MAP, myelodysplastic syndrome, aplastic anemia, paroxysmal nocturnal hemoglobinuria. Chickenware appearance in bone chondroblastoma, in brain oligodendroglioma, and in alcoholic steatohepatitis. Microfilament actin, microtubule tubulin, intermediate desmin vimentin. Primary oocyte arrested in 1-1, prophase, meiosis 1. Secondary oocyte meiosis 2, metaphase. Incontinence associated with cystocele, and there is uterine prolapse. Stress incontinence. Time taken for capacitation is around 6 to 8 hours. Swab do not show stained blue, then it is ureterovaginal fistula. Rectal carcinoma with lymph node spread, then first you have to do chemoradiation, then only surgery. T-half equation, you know clearance is liter per minute, so clearance inversely related to T-half, but it's not T-half is equal to correct. There is a constant called 0.693 into VD by T-half. Loading dose is equal to clearance into volume of distribution. Correlation, if it is strong, it will be more than 0.5. Less than 0.5, weak correlation. It can be positive or negative, then plus 0.5. If negative correlation, you can take it as minus 0.5. Vital statistic versus population statistic. Vital, that means birth rate, birth data, death rate, or fertility rate and mortality rate. That is another term related to that only. Birth, fertility rate, mortality rate, death rate. In between there will be natural growth rate. Others are population statistic. Mortality indicator, mostly you can identify there will be related to death, but sometimes life expectancy, years of life lost, you have to be looking for that also. Ogive is actually cumulative frequency polygon, so it will be always rising up. OMG, God is above, so it is going above. Ogive. Natural history of disease best studied by longitudinal study. In this data, TP true positive, but that marked one is false positive. Bayes theorem is actually to calculate positive predictive value, sensitivity into prevalence divided by sensitivity into prevalence plus 1 minus prevalence into 1 minus specificity. You can calculate negative predictive value also. Standard error is equal to standard error is actually your the variation between the each value from the population mean, sample from the population mean. Sampling error versus systematic. Systematic error is bias, sampling is random chance. So stay tuned for again more questions. Till then, bye.